Thanks, Doc. So today, in the interest of time, we just have about 30-45 minutes in this particular studio. You will allow me to use my laptop, since I know comments are going to be flooding in, questions are going to be coming in through, and so you'll allow me to just be checking, and then relay the same to Dr. Yuri, who doesn't have a gadget on his end. Okay, so our first question of the day, Doc, would probably be, yes, you've told us what you do in a nutshell. So what I would love to know more about is your role and how long you've worked with a dialysis patient in essence.
Thank you. So I've directly worked with dialysis patients, or even patients with renal dysfunction, for over a decade now. I started back when I was an employee of the Ministry of Health in a public facility, so I used to work in that dialysis unit. Of course, in medicine you work in the technical capacity, so reviewing the patients, doing procedures including hemodialysis catheter insertions, and then slowly on I moved into other roles. There's a part-time I was also working as I was overseeing a team of colleagues, the doctors, so, and I was also seeing patients. But now more directly, my role now is more on clinical governance. So I do sit in the corporate office, yes, but from time to time I do go to dialysis units. Case in point, yesterday I was in one, reviewing patients and listening to their concerns, addressing them. Any clinical issues that come up, we sort out.
Oh, great.
So in a nutshell, I'll say about over a decade, and mostly it's clinical governance, but also the direct clinical care. Yes.
Absolutely. Over your experience for the last 10 or so years, Doc, normally when someone hears of dialysis, if they have never set foot into a dialysis unit, there's always a mix of emotions and fears. All right, you have experienced this before, right? So what would you tell someone who's just starting out as a dialysis patient, because they have fear, they have emotions, they're like, wow, how am I going even to start this?
I'll say I think fear is a normal, I can say, response, especially when you're experiencing some sort of adversity in life. So I'll tell them it is okay to be scared, it is okay to be afraid, because sometimes you are delving into the unknown.
Yes.
But it is always good for us to remember that as much as things happen in life, there are also other people that can work with you in that journey, and that's why we are here.
Absolutely.
So as much as they are afraid, we have a very good team that can explain what they are going through. So it from the top starts with a nephrologist, in case they do see one, who will explain to them what had happened for their kidneys to fail and not function properly. And then if they do require dialysis, definitely they'll be informed on the procedure in terms of identifying a unit. A dialysis prescription will be written, the frequency of coming to the dialysis unit for sessions, and then also how they'll be supported. We have a wide repertoire of teams working in the clinical space, from nutritionists that will be able to take them through the nutritional component. We have kidney supportive care people who will touch into the psychosocial and psychological bit, and even counselors and psychologists. Yes.
So speaking of which, about fear and probably, yes, I agree with you. Many people, if they set up in fear, is probably the diving into the waves of the unknown, into oceans of unknown. So, and probably today we might just need to break down what dialysis is. I think that should have been the first question before I asked about the fear itself.
Thank you.
So probably, if in not so medical jargons, very chewable to a layman who does not understand. I've been lucky enough to be in the healthcare for a few days. So yeah, But there's that viewer outside over the screens that might not be able to understand. So in very chewable words, what would dialysis be like, be like?
Okay, I'll try and break it down simply, although you're putting me on a hard spot because I'm used to medical jargon. I wanted to start by saying that dialysis is a form of renal replacement therapy, and I know that is technical.
That's super technical.
Yes. So what I can say is when the kidney function declines, or maybe I can say when the kidneys don't work anymore. So kidneys are organs that are found somewhere in, I can say, within the abdominal cavity. They are mostly, I can say, on the flanks. I think that is an English term, which is a bit easier. Closer to the back, yes. So their job is to, maybe for a layman, maybe discuss how we make tea. Okay, so when you make tea, you have a sieve. Okay, and you have tea leaves. Okay, so in the olden days we used to cook tea. You put milk, you put tea leaves. Okay, and then you put it through a sieve. So what the kidneys do, they do sieve toxins. Okay, and then excrete, eliminate those toxins. It also helps to form urine, what we see. So people pee. For you to form urine, you have the kidneys that do that. So it removes excess fluid. It also removes toxins from the body. So what happens here is, like, if you have a sieve at home that is worn out and it's now developing holes. So you find as you're taking tea, the tea leaves are getting to whatever. So yes, so now it's no longer doing the job of sieving properly. So you're losing what you're not supposed to lose, because there are certain elements that some biochemical, I can say, elements that need to stay in the body, others need to get out. You find that sometimes you're now leaking things like proteins that you need. So when the kidneys are no longer working properly, you find the patient will now accumulate toxins in the body. So they start feeling sick because the toxins, it's like, this is not a very good analogy, like if a toilet blocks, okay, you find there's a lot of stench that comes out of that. There are a lot of problems. So again, if you're not passing urine, it means now you're not able to eliminate waste. So just assume that someone is having,
in your body.
Yes, so assume urine is building up on someone's body. And urine, has water, but it also has other, biochemical components. So this does affect the patient's health over time, and they start feeling sick. If they accumulate a lot of fluid, they start swelling up. So the first commonest symptom is a patient who's having early morning facial puffiness. So they wake up early in the morning and they find their face is swollen or their feet are swelling, and sometimes they also have difficulty breathing because some of the fluid is going to the lungs. So they will require dialysis now, which will function as now the kidney. So since your kidneys are not working, we need to take the blood, out of the body. It goes to a machine. We usually call it the extracorporeal circuit, for it to be cleaned. So in that machine there's a filter that works as the kidneys. Once it's cleaned, the blood is now brought back to the body. So that takes about, give or take, depending on the prescription, some might be 2 hours, some 3 hours, some 4 hours, or even longer. Yes, so that's how a dialysis machine works. But just to mention, apart from dialysis, the other modalities are something called peritoneal dialysis, which is different from hemodialysis. So in this case, you use the patient's own, there's a I can call it a membrane in the abdomen called the peritoneum. So they put a peritoneal catheter, and then you put in fluid, and then it seals through the toxins and it comes out. That's another modality. The other way is to now get a kidney transplant, because if the kidney is not working, you take out the one that's not working, you put in another one.
I think this aspect of kidney transplant, that is a whole topic on its own.
Yes.
If God gives us more time on this earth, we should be able to discuss that. I know it's quite a wide topic. Kidneys are supposed to match,
yes,
and things like those. Yes. Expenses involved. Where can you get the transplant done? Preparations. It's a whole topic.
Yes.
But today we are just trying to focus on if you are a kidney patient. Or you are not a kidney patient, if you are a dialysis patient, or you have been asked to go for dialysis, what are the first steps that you need to take? What are the first emotions, how they would feel like? And that is what Doc is here to unpack. Doc is also here just to tell you, to stamp authority and tell you how many centers there are in Kenya under his watch that you can be able to access. Right now I'm going to be talking about a few centers. In Greenspan there's one at Garden City, there's one at Greenspan, that is Avenue Healthcare Greenspan Medical Center. There's another one at Garden City Medical Center. There's another one at Broadwalk Medical Center, equally again Avenue, and then of course Avenue Healthcare Thika. That is where you can find Doc and his team. And the good thing is, Doc, this is SHA accredited.
Sure.
So it's SHA accredited. That means if you have SHA and you've been asked to go for dialysis by your physician, your nephrologist, then that means your SHA covers it, and Doc is not going to bill you.
Yeah.
No single cent. Okay. Usione ati ni Avenue alafu nasema sasa huko sitalipa 1 million. Come for dialysis at those particular centers: Greenspan Medical Center in Donholm, Garden City at Garden City Mall, that is on Thika Road. You can go to Thika all the way down to Thika, and then of course you can come down to Broadwalk where there is a dialysis unit, and then you can be advised. So moving on swiftly, Doc, there's a question here that I'd prepared for you. What are some of the normal side effects after dialysis, and when should one really be concerned? So I've come to dialysis, the usuals that I've been experiencing, but then once I'm on that dialysis machine, I feel like, hey, there's a shift in my body. So that's what I'm trying to bring up.
Yes, certainly. I think the way I'll layer the question is, normally, when you're making urine, you pee throughout the entire day. But in this case now, you want to do what the kidneys have been doing in just a span of either 3 or 4 hours. So you find there's a very quick shift of both fluids and also the biochemical elements. So in terms of some side effects or symptoms that patients experience, the commonest is post-dialysis fatigue. Most patients will complain that once they leave dialysis, they are unable to perform, the normal daily activities, and they need to either rest for a while because it's quite tiring. Just lying down for 4 hours, and then there are a lot of changes because you find as you're removing toxins, and there are a lot of biochemical changes. Some of those elements like calcium, potassium help with muscle contraction and movement. So you find that the motor activities are affected. So they become really fatigued. The other one is muscle cramps. You find patients who get a lot of cramps. They feel their entire body is cramping, they're in pain. There are a few cases of patients that will develop nausea. They feel like they want to vomit, to throw up. There are some that will get a bit dizzy, because imagine we have removed about 2 liters or 3 liters or 4, depending on what we are targeting at the end of the session. It's been done within 4 hours. So if a patient came in with extra fluid and you've removed about 2 or 3, the blood pressure is going to drop. So the patients will feel dizzy. Some will really feel dizzy, and then some will develop headaches also, because as you're saying, you are drying up the patient, blood pressure is going down, so even the blood that is flowing to the brain cells is reduced. So they do develop headaches. Yes, and some will develop other issues like sleep disturbances, but what I'll encourage patients, if in case they do develop any of those symptoms, they need to just communicate, speak out, see how we can help. We can help them adjust. We can also discuss any coping mechanisms, because it gets time to get used to.
Yeah. The other question is, so with some of these symptoms in terms of dizziness, that means this patient can just stay back at the facility and not send away the patient and like, your time is up.
For sure. I think what we usually do before, there's what we call pre-dialysis screening. So you need to screen and see this patient is stable to be dialyzed. Because it's always good to prevent those signs and symptoms rather than, a patient is now dizzy and you want to sort it out. Because other causes of dizziness are like anemia, for example. So in such cases, you'll intervene early and decide to either transfuse the patient as you're dialyzing, so they don't end up being more dizzy or worse. But in case they develop such symptoms, we also do post-dialysis screening. So we check all the vital signs, which is the blood pressure, of course, heart rate, among others. And then we observe them for a while. So they're put on a couch, sometimes made to lie down. In case we need to give any medications, any treatment, they are given until when the patient is comfortable. In certain cases, we do need to sometimes reach out to even the caregivers, so the relatives, to come either. If the patient needs to be accompanied, then they're accompanied. But in certain cases, in extreme circumstances, you might need to even admit the patient for observation for just about 48 to 72 hours. Yes.
So that means probably other than Thika, which is an inpatient facility, that's the only place where, in case you need to observe, or you can stay as late with the patient.
Yes, because we do work in shifts. Our first core value is again patient first. We can never abandon a patient because it's time to close or something like that. If a patient requires observation and does not require admission, then they'll be observed for that duration of time. And since where we work, we also have other departments like outpatient, for example. The outpatient doctors, in case we need to put the patient in a room, in a couch to be observed, also the nurses will be there looking after the patient until they feel better. And in case they don't, then we see how do we make the decision together with the relatives and even the patient to even admit the patient just for observation. Yes.
So we are moving on pretty much well, Doc. I just wanted to demystify some of the myths that have been in the spheres, and you probably have had some. So what are some of the biggest myths or misunderstanding that new patients have about dialysis itself?
I think there are quite a number, because I don't know whether it's an African thing, but people fear sometimes get a bit, the word is squeamish when they see blood coming out. In dialysis there's always blood. Blood is being taken out of your body, so people feel that if someone is already having dialysis, then that's their end. It's only a machine that can help you. It's like we're resuscitating them. So that is one common misconception. The other one is in terms of dietary restrictions, because we restrict what patients can take, because if the kidneys are not working well, you can't continue drinking as much fluid as you used to, eating the same things because of the harm that it might cause. So some do feel that before they come for dialysis, they can just eat whatever or drink anything because it's going to be cleaned anyway. Yes, and that ends up now with the issue of the signs and symptoms that they experience post-dialysis, because now we have to work extra hard to remove the extra fluid, also to just have a very good clearance of the biochemical toxins, which when we do that in that particular period of time makes them prone to those signs and symptoms. The other misconceptions are, of course, in an African setup is witchcraft, because a person will say that this person has been bewitched, that's why their kidneys are not working. And then, of course, on the flip side, for the ones who are more on the religious side, they'll feel like it's a punishment from God, that maybe I didn't do something right, and that's why I'm being punished for this. So again, depends with upbringing, depends also with sometimes the environment, the people that surround you, and also the information that people feed you. Yes, because you know, in an African setup, once you're sick, you find that everyone around you becomes a doctor. All your relatives know someone who can help. They know either a medicine man or maybe a witch doctor. If they're saying that if the doctors have failed, I know someone who can give you. In Kenyan setup, we say mitishamba. Yes.
On this aspect of information and people, I love to call we Kenyans Google doctors. Any other small thing, and every one of us will be running down to Google and now it's worse. Now we have ChatGPT. You find someone is quickly typing up just to find out. Well, that is information too, but I would prefer, and Doc will agree with me, go sit down with a professional, let them discuss your disease, if there's any, with you. That way you save yourself a lot of uncertainty, a lot of self-diagnosis, a lot of unajua hata labda una issue na kidney, but we juu ulisema doc alisema nikiamka nimefura macho ama miguu, hiyo ni sign ya kidney failure, but that might not be the case, unajua. So lazima ukae na physician wako mudiscuss, atakwambia kwa mfano doc atakwambia freely, before mtu akwambie unahitaji dialysis, there are number of tests zitafanywa. Hautaambiwa tu straight we kimbia ingia dialysis, ufanye dialysis, unajua. Ama kama umekuwa ukifanya dialysis, then it gets to a point, doc, and I think I've witnessed this before. Someone has been doing dialysis maybe for about 6 or so months, and then they get to a point and it's like, no, I can't do anymore. You've witnessed that before, yeah?
Yes.
I know this is all purely mental, because it wears you down, and then you feel there's too much on you right now, and then you just decide, let me just give it up. What would you take on that, doc?
I think I'll take it as sometimes we looking at grief, because when for dialysis patients, when the kidneys are not working, they feel like they have been disabled in a way, that they have lost something. As much as we call it like a disability, it's kind of an unseen disability, that why are my kidneys gone? And of course many patients will process grief differently. There are some that will be in denial and will not seek care up to the end, and then they're only brought in, when they're pretty bad, in a bad shape,
very critical.
Yes. And then there are some that go to the second stage, where it's kind of, after that it's either anger, they're in anger, they're wondering, maybe it's my neighbor who did this, maybe it's so and so, so they become very angry. Why me? You also get patients who are now into the bargaining phase, where they now pray a lot. They tell God, if I'll be a good person, if you just bring back my kidneys. And then there are patients who outright just accept that. Others also go into depression. So again, it's the patients process this differently. You might find, like those patients who decide to stop coming for dialysis, you might find that probably they are going through a certain phase, and they didn't get the help that they deserved, in terms of when they were diagnosed, how it was explained to them, how they were onboarded into dialysis, and also the options that they were given. Because you might find it's a young person, they can still get a kidney transplant. Dialysis is just a bridge to get them there. So there's still hope to patients, if they, of course, good candidates for a transplant. Also getting a donor is a whole process. But the other bit is also looking at the coping mechanisms around the patient. Are the relatives supportive? Are they getting other things that are frustrating them? So they act out, sometimes out of anger or out of not knowing, and then they all of a sudden just withdraw from dialysis.
Absolutely.
Yes.
Thank you, Doc. I think Doc has just talked about the next thing that I wanted to talk in terms of support. How do we support dialysis patients? That means one is family support, and I'm sure there is a support group of sorts for dialysis, people who are just going through dialysis, to pass encouragement to the next person. And then, of course, in every of those facilities that I've mentioned, there is a counselor. There is a counselor, there is a nutritionist who is able to guide this particular patient on what kind of food stuff to take and not to take, or on what modalities and things like those. So you should be able to be taken pretty care of, okay? And Doc has also mentioned about the encouragement. He has also, one of the questions that prepared was the piece of advice to a new patient. What would you really need if you are going into this phase of dialysis, okay? And so he has highlighted that pretty well. So like I said again, for the interest of time, those who might just have joined us, I am with Dr. Yuri Oketch, who's the country medical manager at African Health Network, and he under his watch there's over 30 facilities across the country that have dialysis units that you can access, and you can be helped if you are a dialysis patient. And he has said if you have SHA, you do not need to pay a single cent. All right, so probably Doc, since we have done our 30 or so minutes, we have actually done 40, probably you can give us a parting shot, and then if there's any questions that came up, we will be happy to respond to them, and then Doc will be releasing Doc to go and do his business of the day.
Thank you, Gaston. I think I just reiterated your last point. Us being the largest chain of dialysis centers across sub-Saharan Africa, we are looking at first providing accessible dialysis services, meaning that these centers are close to where the patients live. So it is not just in the urban centers, but you do find us in most rural setups, so that patients don't need to travel for long distances. So accessibility is key to us. Secondly, it is on affordability. It needs to be affordable to patients. First, if you're cutting transport costs, makes it affordable. Second, it's fully covered under SHA, so patients don't need to do any out-of-pocket payments, which is a plus to patients. And then there are also other things. Meals are given for free in the dialysis unit. They're given medications. I think there's erythropoietin, there's iron that usually helps with build-up of red blood cells, and many other services that we give, like psychosocial support and also nutritional support. I think the other bit is our quality. We do offer quality dialysis services, so that when we have our patients, they are assured that they'll get the best treatment, and we'll walk this journey with them. It's a long journey for dialysis patients. We need to know that it's not a race. So we are here together with you to walk this journey. For dialysis patients who are finding it hard to cope, or even the ones who are coping, always feel free to ask questions whenever you're in a dialysis unit, or also reach out to either our members that you can find in our websites, or even directly through our heads in the unit. We'll be able to help. Thank you.
Thank you so much, Daktari. Thank you for honoring this particular invite and joining us on this particular segment. We hope to have more and more of this, just to discuss what really is dialysis, what we need to know about our kidneys, the next step of action. If you have any questions to Dr. Yuri, feel free. You can drop us a chat on the comment section. If not on the comment section, inbox, and then we'll be happy to link you up with Daktari. But if you're in Donholm and its environs and you need support, we'll always be at Greenspan Medical Center. We have a unit there running from as early as 6 all the way to 8 p.m. Same as Garden City, from 6 a.m. all the way to 8 p.m. Broadwalk the same, and then of course Thika the same, from 6 a.m. all the way to Thika is all the way, because it's a 24-hour facility. So anytime you need support, and of course there's always a number that you can call, 0711 000 000. That's the number you can call. It's on the switchboard, and you'll be able to be assisted by the personnel there. Just ask for whichever center you want to be assisted at, and then you will be assisted. My name has been Gaston Obomba, will always be. Thank you for listening.